Well, today we're talking about risk factors, signs, symptoms, and stats associated with prostate cancer. Here with all the details is Dr. Douglas Rivera, who's a board-certified radiation oncologist and medical director at Austin CyberKnife. Good morning, doctor.
Good morning, Stephanie. Thank you for having me.
Well, thank you so much for being here. We've got a lot of information to cover today. So I'm going to start by picking your brain with asking, what are some risk factors that might affect a man's risk of actually getting prostate cancer?
So number one risk factor is not watching enough Studio 512, actually.
I love it.
Right? Yes, everyone should do more of that. But there are a few things. First of all, we do think there's some family histories. People have family lineage, genetic things, and certainly we see this happen in clusters of families. And I've treated several brothers and people who've had prostate cancer. Ethnicity, there tends to be more of a predilection for African American males. For reasons we don't always know, and really age is a large part of it. You know, people as we get above the age of 50, and certainly as we get older, that incidence just keeps getting higher and higher with age. And then lastly, there are probably some environmental influences, not all of which are very clear, but there have been recent trials looking at egg consumption and higher egg consumption, maybe prostatic cancer. Again, not a perfect thing, but those are some correlations that we see.
Okay, lots of good information there, and a good reminder to make sure and watch Studio 512. I love the plug.
Yes.
Now let's talk about some of the signs and symptoms that are associated with prostate cancer, doctor.
So the vast majority of people, fortunately, we kind of catch this with a blood test. So most people will be what we call asymptomatic, having no symptoms at all. But based on their family history and age, they may have a blood test which checks for the PSA, prostate-specific antigen. And if that's elevated, that can be an indicator potentially of having prostate cancer. So that's the vast majority of patients. However, you know, when people have not seen a doctor for a long time, or they have a very aggressive prostate cancer, as that grows, they could have symptoms would be related to changes in your urinary habits, either a poor flow, even pain, potentially even blood in the urine. Those could be also some signs of prostate cancer as well. But again, vast majority of folks, fortunately, we catch it before they really have any symptoms at all.
Good to know. Now, what are some of the current statistics for prostate cancer? Because I know you have a couple shocking stats there.
Yeah, so prostate cancer is the most common cancer we see in males, and that excludes things like skin cancers. But of all the cancers we see in males, the prostate cancer will be the number one diagnosis. Now, it is so common, and it depends on the era in which you look at this, but it's anywhere from 1 in 6 to 1 in 9 males will have prostate cancer in their lifetime. That's a very common cancer if you think about the straight numbers of that. 14,000 just in Texas alone in any given year. However, in terms of the number of people that are cured or not dying from prostate cancer, it's fairly large. But that being said, it is still the second most common cancer death in males.
Wow. Okay, so let's talk about how it's actually diagnosed then.
So the way that we typically diagnose this is based on seeing a blood test that may be elevated and then getting a biopsy. That's really the gold standard of how we diagnose it. One is being suspicious of it, and number two is getting a biopsy to confirm whether there's cancer cells in the prostate or not.
Okay, and you know, if you are diagnosed with it, men who are diagnosed with prostate cancer are then treated with the CyberKnife robotic radiosurgery system over at Austin CyberKnife. Can you tell us what CyberKnife is and how it treats prostate cancer?
So the CyberKnife is a special radiation machine that we use that does something called SBRT. It stands for stereotactic body radiation therapy. What that really is doing very focused radiation just to a very small area with 5 treatments or less. And so when we're doing this for the prostate, we're really focusing on folks that have cancer we know is limited to the prostate. So we're able to focus that radiation to that small area. And it's a non-invasive approach, so they really don't feel any of the treatments. It kind of passes through that prostate and gets rid of their cancer cells and tries to preserve really the organ itself. Unlike other therapies, which may either, quote, just take out the prostate or may try to kind of melt away or ablate, we call part of the prostate. This is really meant to kind of preserve the organ, really.
Fantastic. So you just touched on it a little bit. I want to dig a little bit deeper here and talk about how CyberKnife compares to conventional radiation therapy and what are the benefits of being treated with CyberKnife.
Yeah, so one of the benefits of it, because it is kind of a specialized machine, really targeting things and working more on focusing on things that are within the small area, it has the ability to really treat the prostate in less treatments. And so typically we would have to kind of break these treatments into smaller amounts because we're maybe treating more normal tissue, and that could be treatments as much as 45 treatments at a time for the prostate. And for the well-selected patient, we can actually trim that down into just 5 treatments. So it means a lot more need to kind of come in, and more importantly, a lot less treatments that they have to drive in for every day.
Wow, that's incredible. So I know we've covered a lot of ground here, but I just want to hit this one home too and talk a little bit more about why a man diagnosed with prostate cancer should consider Austin CyberKnife for treatment.
Yeah, we were really the first folks in Central Texas to treat with this kind of idea of focused radiation with only 5 treatments or less. And so we have the most experience doing it, and we've been doing it for a long period of time now. And so we have a dedicated team that's very familiar with the process and is very engaged with walking patients through the whole process, how to do it, getting the treatment done in a very effective way. And then as far as follow-up care and the transition back to their other physicians, we're very used to doing that at this time.
Now, Dr. Rivera, I've heard it a couple of times here. The 5 treatments or less sounds really great, especially in the era of COVID. Can you just touch on some of the benefits that can be included in being treated, even in a time where COVID is still front of mind?
Because we treat a lot of patients from all over the area, the state, or even sometimes outstate, we've actually been pretty proactive in doing telemedicine visits. And so either initial consultations and certainly for follow-up visits and other things, we've been very able to do telemedicine visits with our patients to kind of keep them out of the office. Another benefit of this, because it is so little treatments rather, is that rather than having to come every day for 9 weeks, for example, we're doing treatments in sometimes 1 treatment, or for prostate usually 5 treatments or less. They have a lot less risk of exposure. They don't have to leave their house as much to come for the treatments. And then lastly, the other thing that I also get a lot of questions about is, can I have a vaccine now while I'm getting treated, either before or after or even during? And it is okay to have a vaccine during this process of getting treatment.
Great information. Very important to know. Thank you so much for your time, Dr. Rivera.
Austin CyberKnife is located on I-35 near the Del Seton Medical Center at the University of Texas. Call them at 512-324-8060 or go to austincyberknife.com for more info.